Welcome to the Disability Partnership Calderdale Annual Report for 2020-2021. We received our funding from the National Lotteries Community Fund in 2019. This year was year 2 of the fund. There's 1 year left to run. We had to deviate from our original funded work plan this year in response to the COVID lockdown, which brought an increase in requests for support from our members. These support requests were different to the usual things we'd get asked to help with. Because of the flexibility of the National Lottery funding officers, our workers were able to keep working whilst other charities had to put their workers on furlough. We had to increase our hours all the way through the lockdown to increase the work we did because there was such a lot of demand, and it was actually new and different requests, things we didn't even know about, things we hadn't come across before because COVID was new to everybody. So it was a very steep learning curve and we had to learn quickly to be able to help people. How did COVID-19 affect us and our members? Many of our members are clinically vulnerable and were either shielding or self-isolating. As such, all our face-to-face activities stopped, as did those for most organisations. We moved all our activities onto Zoom, which is an online video platform. But still, people found it hard to get the information they needed. And because of this, demand for information dramatically increased. We had 150 new member requests and new subscribers in the first 3 months of lockdown, as more and more disabled people turned to us for support. People told us that they couldn't get online supermarket deliveries due to there being no available slots, especially at the start of lockdown. They were so busy, people just could not get the groceries and they couldn't go out to go shopping because they'd been ordered to shield or self-isolate by the government. This made it really hard for disabled people and for their families and carers. And those who were able to go out who weren't shielding still found it really, really hard going shopping. They found the social distancing and the COVID safe measures really difficult to manage. For example, for people that are sight impaired, guide dogs are not trained to socially distance, so they couldn't stick to the rules. Some people with learning disabilities couldn't understand the one-way systems, which caused anxiety and panic for people. Some people couldn't maneuver their wheelchair or their walking aid or their stick and found the queuing outside very tiring, especially at the start of lockdown when shops were only allowing 1 or 2 people in at a time. There were long queues forming outside shops. Hearing impaired people can't read the lips of shop staff who are wearing masks. Toward the end of lockdown, some shops adopted clear masks or visors, but again, at the start of lockdown, people didn't know, and it's all new to them as well, so it was just really hard. Some people with a hidden disability are unable to wear a face covering. It may be a physical condition, such as breathing problems, or it may have been a learning disability or another issue that you can't see from the outside. This caused a lot of people distress, and in some cases, they were victims of hate incidents and hate crime. The perpetrators don't believe the disabled person and don't understand their needs. People were accusing disabled people of trying it on, if you like, breaking the rules, getting away without wearing a mask, pushing to the front of the queue. And people were very impatient and a lot of people were frustrated. And the people that took the brunt of that were those disabled people who needed the help the most. So what did we do to try and help? We created a local food delivery list, which took prominent place on our website. It was a list of local shops that delivered groceries at a time when there were no available slots at the supermarkets. We went around Facebook, Twitter, just anywhere and everywhere we could find, and went to local shops and contacted them over the telephone and email to say, do you do a delivery service? Are you delivering? Some grocery stores and also restaurants and pubs were making meals, ready-made meals, and delivering the menu rather than closing down. We were able to do this really quickly, much more quicker than other organisations could do. And the Calderdale Council found it really good and really useful, so they adopted the list and added it to their website. And then they had workers who continued to add to it and make sure that it was up to date. Because of this, our contact details were added to an information leaflet that Calderdale Council sent to everyone who was shielding, recommending us as a source of support and information, which again further increased the demand for help that we were giving to people. The council also gave us 4,000 disposable face coverings, which were distributed free of charge to anyone who requested them in packs of 10. We also purchased clear face visors to give to taxi drivers and shop staff to enable people to lip read. And we also gave these to any person who needed one. That's a picture of one of our members demonstrating the clear masks. We bought hundreds of sunflower lanyards and face covering exempt cards, which we posted to any member who requested one. At the start of lockdown, when you were only allowed to go out to exercise or to shop for essentials, again, we put the card on the right, as you can see, I am out to exercise or shop for essentials. Then later on in the pandemic, we changed these cards to the face covering exempt cards. However, we found that a lot of people were abusing this, because you don't have to prove that you've got a disability to be able to get one of these lanyards. Anyone can go on the Sunflower website and buy these for £1. And there were some quite naughty people who on eBay were selling them for in excess of £20 when they only actually cost £1 on the site. So what we did towards the later part of the pandemic was we worked together with Calderdale NHS and the CCG to create a local Calderdale specific face covering exempt card, which had the NHS logo on. We laminated these and we bought some Disability Partnership Calderdale lanyards, and we sent these to anybody that wanted one, again free of charge. People had more confidence in these because they had the NHS logo on. They were a bit more credible than the sunflower ones. Additionally, the police and local shops such as and taxis and public transport like buses and trains were aware of this system. And so when people had one of these, they knew that they were legitimate cards. Again, we could give them to our members that we knew needed them, and they weren't available to anybody and everybody to get, like the sunflower ones were. We helped people in lots of other ways as well. Our administrator, Nikki, helped people with the services that had moved online. Many people don't have access to a computer or are not able to do it for themselves. Sometimes there may be older people that aren't used to using the computer for things, and there may be people that aren't able to do it because of the disability. Things like booking COVID vaccination appointments. People in the top 3 tiers of the vaccination programme were asked to go to the hospital for the Pfizer vaccine. But the online booking system wasn't very simple and wasn't straightforward. So people were asked to call us, speak to Nikki on the phone, and she booked it there and then and gave them their appointment details. She also helped people with blue badge applications and renewals. She phoned and challenged shops that disallowed people entry if they weren't wearing a face covering. And she personally hand-delivered all the clear visors because they were too big to go in an envelope to post. We also increased our phone line support to 7 days a week. Before the pandemic, we ran a Monday to Friday service, but people were so in need of help that the weekend's a long time to wait when you need something important. And so again, we increased to a 24/7 service. We also increased the frequency of our newsletter. Before the pandemic, it used to be every month, but we increased that to every week. We also increased the amount of information that we posted on our website. The next few slides are going to go into a bit more detail about this. So this is just an example of one of the printed newsletters. We send the newsletters to over 500 people every week, but 100 of those 500 need it printing out on paper because they prefer it that way for a variety of reasons, from not being able to use computers, maybe they don't have a computer, and a variety of other reasons. So the picture on the right there is just an example of one of our newsletters. It's very plain, it's very simple, and it's like that for a reason. We want to keep it that way so it's easy to read. It's a simple blue on white with the pictures. Now we do actually send this out in a variety of formats. If people prefer a larger font, we print it out on larger font. For sight impaired members, we print it out on yellow paper and we do the type in black ink. And again, we have a whole range of solutions that we can give to anyone who requires it in a different format. We increased this from once a month to every week. By March 2021, 570 people had signed up to receive our newsletter. Of those, 355 people are with disabilities and their carers. Of that 355, 197 are our voting members. These are people with physical and sensory impairments. 158 of the 355 are affiliate members, which includes carers and people with a range of other disabilities. Hard copies of the newsletter are sent out to every week by post to 100 people. All this was made possible thanks to a grant from the Community Foundation for Calderdale. The money they gave us helped us buy more paper, ink, stamps. If you can imagine a second-class stamp to 100 people, that's what, £67 every week for 18 months. The cost of the envelopes, the cost of the time for the staff to physically print these out and post them, the time of increasing the hours of the workers, going from part-time to full-time, increasing the phone line from 5 days a week to 7 days a week, and the upgrade to our website, all paid for by Community Foundation for Calderdale. So big thank you to them. So I'm going to talk about our website now, which we have to say we are very, very proud of. It's a fantastic resource for anybody with a disability who would like to get information. We have news from local organisations, from the local government, from the council, but also from the national government as well. And we increased the capacity of this so that we were able to host a lot more information than we could before. Prior to the lockdown, we used to post about 25 items of news every month, but we were posting over 100 by the middle of the pandemic. The website traffic increased hugely. We used to get around 4,000 hits a month. It also increased to over 1,000 every day, and actually at the height of the pandemic, 4,000. We had a story about the face covering exempt cards which went viral, and if people type it into Google, the page on our website was the first one that came up on Google, and that was thanks to Phil, our development worker, who was able to put that on the website so fast that it'd been on the announcement on the BBC that tea time, and a couple of hours later it was on our website. So when people typed it into Google, ours was the first one that came up, and that's really, really positive to our organisation that we have Phil, who works for us, who is able to get the news and post it immediately on our website, so people are getting the news as it happens. So as again, just saying, we increased the capacity to produce over 100 stories a month. That's 4 times the amount of news we used to post. And we'd like to think that we're uniquely placed to provide an independent, information-based support service for disabled people who might find Googling for the information difficult, or they may be digitally excluded. The news that came from the government was so long. You would talk 5-6 pages of writing for every news item that came out, and it was very, very difficult to read. Additionally, because it was all new, it was changing all the time, and it was really hard to get what you wanted. The part that was relative to disabled people, of course, was only maybe 1 or 2 paragraphs. So Phil would go through the news and he would sift through, simplify these, make them smaller, more to the point, easier to read. And he would really highlight the areas that were of interest to disabled people, and he would give them pride of place on our website so that people could get the information quickly and easily. As well as that, Phil is continually upgrading our website. He has buttons on the side. So for example, the blue button for health, the green button for Calderdale. Behind each of these buttons are a range of articles and links to other organisations, information about services, information about other organisations, and all this is all on our website in really easy to find, really brightly coloured and colour-coded boxes. We also subscribe to press releases. It's the same press releases that the newspapers subscribe to, so he gets the news as it happens. So that was everything we've been doing in response to the pandemic, but the day job continues. As well as all the extraordinary work we've been doing, we've still been ticking along doing some of the work that was in our original work plan that was funded by the lottery. So I'm just going to quickly talk about that now. So one of the main things we do is engagement and consultation. We've taken part in many engagement exercises and consultations on behalf of the public sector, and we're recognised as a conduit for engagement with disabled people in Calderdale. Some of our partnerships, the Calderdale and Huddersfield NHS Foundation Trust, Calderdale Clinical Commissioning Group, Calderdale Council, and we also sit on the regional stakeholder network for disabled organisations in Yorkshire and the Humber. We continue to work with all our partners, and we now have 217 professionals that subscribe to our newsletter, and this number is growing daily. We have representation on various panels and steering groups that consider feedback from disabled people about services, and we take part in many engagement working groups. The Yorkshire and Humber Regional Network meets every month, and information is fed directly to the Government's Disability Unit in Westminster, who write the strategic plans for disabled people. We also have information on our partners' websites and our partners' screens, so screens in doctor surgeries and screens for the council workers, screensavers. And this is just one example of a picture that was on Calderdale Council screensavers. When the council's workers' computers go to sleep, a series of pictures would flash up, and this is just one of them. We've delivered many online presentations about our organisation, teams of workers in the public sector. We have visibility within their services. Our leaflets are in their waiting areas, and people refer to us. So our partners refer disabled staff and disabled customers to us. We've continued to engage and consult with people throughout the pandemic by going online. We used to do focus groups and newsletters and face-to-face sessions. We've still been doing it, but it has been online. A few of the very important ones we've also posted out to our members that receive the paper newsletter, and we've also done a lot of work over the telephone by speaking to people who weren't able to join the online Zoom sessions. We did a survey of user experience of the NHS. We did a survey to find out people's experiences of lockdown and shielding, and on behalf of the NHS who wanted to know how to engage with their patients. We also helped the NHS find out what people thought about the GP surgeries and what people thought about the COVID vaccinations and how they experienced the whole process from booking right through to attending their appointment. We helped Calderdale Council find out what people thought about going shopping during lockdown, working on the redevelopment of Halifax bus station, the A629 and the town centre. And then more recently, we've been working with the government and the Department for Work and Pensions on the National Disability Strategy, which has been posted by the government. Now, a nice big piece of work that we're doing, we've done throughout lockdown and we're still doing it now, is a programme to hopefully improve services for people with sight loss or sight impairment at the hospital. And I'm going to tell you a little bit more about that now. So working together with Calderdale and Huddersfield NHS Foundation Trust and Halifax Society for the Blind, I've been leading on a project to look at how the hospital services can be improved for people with sight loss. It came about after one of our trustees, Peter Melling, who is blind, stayed in hospital, and he highlighted some areas for improvement. Let's just say his experience could have been better than it was. It wasn't bad, but there were some very quick and easy things that could have been different, which would have made his day much more enjoyable. So I passed this information on to the head of patient experience at the Hospitals Trust. We've been doing this work for about a year now. Every quarter we meet with members of the Blind Society and our own members, and we discuss a specific topic each time. This is then fed back to a quarterly steering group with senior managers from the hospital. These people have the power to influence change, and they genuinely do want to listen to what we have to say. We're hoping this work will continue for as long as we're able to do it, and we are hoping in the future to be involved with training of hospital staff going forwards. In addition to all the lottery money that we've received, this year we've also received £25,152 for additional projects. We've received £11,212 from the Community Resilience Fund as part of Community Foundation for Calderdale. This was to meet the increased workload and demand as a result of the COVID pandemic. And that was all the things I've mentioned earlier, such as the face coverings, the lanyards, the increased newsletter, the increased workers' hours, and the upgrade to the website. But they also gave us £3,850 as part of the Department for Culture, Media and Sports Big Night In Fund. and this was to address digital exclusion during the pandemic. We also received 4,620 from Yorkshire Water to raise awareness and promote their priority services register. And we received £5,470 from West Yorkshire Police Proceeds of Crime Fund to raise awareness of hate crime and how to support people to report it through webinars, training sessions, and a series of videos. I'm going to talk a little bit more now about those last three projects. Disability hate crime has increased, especially throughout the pandemic. People told us that whilst going shopping, they were victims of hate incidents or hate crimes. People have been called names, they've been pushed in the queue, they've had the lanyard pulled, and one person was even punched in the face. These people didn't realise that they could report it. They didn't know they should, and didn't actually know how to report it. So we worked together with Calderdale's Hate Crime Partnership and colleagues in West Yorkshire Police to create a campaign for Hate Crime Awareness Week in October 2020, and we are planning to do so again in October 21. We held a webinar and a live Q&A session with guest speakers from the Hate Crime Partnership, the police, the Crown Prosecution Service, and victim support. And we continue to share information on how to report incidents and how to get support. There's lots of information about hate crime on our website, and also we have newsletters that come out that are specially related to the topic. The project, which we're doing in partnership with West Yorkshire Police, Calderdale Council and Cloverleaf Advocacy, is to raise awareness of hate crime and how we support people to report it. Work's going on until the end of the year, and it includes delivery of webinars and focus groups titled Let's Talk About Hate Crime, in which participants learn how to recognise hate crime, how to report it, and how to support a victim if they've witnessed an incident. We've created a series of videos with subtitles and voiceovers in English, Urdu and Polish to complement the webinars. Towards the end of the project, and to coincide with National Hate Crime Awareness Week in October, we're going to be delivering Hate Crime Champions training for any person or organisation that would like to become hate crime champions. These are planned to take place in a COVID-safe manner at Calderdale College. The next project was what we called In Touch. As I've already mentioned, during lockdown, the only source of face-to-face interaction for many people who were shielding was to go online. But many of our members couldn't do this due to being digitally excluded for a variety of reasons. We wanted to help people reconnect with their friends and families and see them on a screen. So we purchased some mobile 4G tablets and linked people up with their loved ones via a video call. We showed people how to use the tablet and lent it to them for a few weeks so they could continue to use it, and they were able to call us if they needed help. We then signposted them to the organisations that were giving away tablets free of charge, or we showed them where they could buy their own if they wanted to do so. This enabled us to take the tablet back and use it for other people. We wanted to show people how the technology could work and sell the concept to them, rather than just giving them a tablet that they may not end up using because they didn't know how to use it, or they weren't sold on the idea of going online. And we still have the tablets, so continue to use them for the longer term. Even though the project's ended, we can still help people, teaching them how to use the online services and also lending people tablets just to give them feel and try and help them maybe get online in the future. We felt that enlightening people to the joys of video calling was very effective. These people didn't want to go online at the start, but once they'd seen for themselves how easy and effective it was to see their loved ones face to face, they were converted to the concept of trying to go online. The last project we've done is the Yorkshire Water Priority Services Register. This helps customers who may be impacted if they can't access water for a short period of time. For example, if there's a power cut or if there's a flood, people can't get access to what they need, and so Yorkshire Water may deliver bottled water. Or if people have got additional needs, they may be sight impaired, hearing impaired, and learning disabilities. They may just have additional needs that will help the utility company ensure they have a positive experience if they changed how they worked. So work on this project is ongoing. It includes promotion via our website, social media, and newsletters. We have also posted information and leaflets to our members who have received the postal version of our newsletter. Future work involves the creation of a video with BSL signed interpretation and subtitles, as well as an information session to be delivered at one of our open meetings. For the next 6 months, we're hoping to continue our excellent engagement, consultation, information and signposting. Just because COVID is starting to reduce, the lockdowns ended and we're now back up and running, we haven't gone back to normal. We don't want to go back to only doing 20 news stories a month and only doing a newsletter once a week. So for the moment, we're still working at the capacity that we were during the COVID lockdown. People have got used to coming to us now. So we have to continue working at the level to meet the demand that we're still getting every day. We're going to continue to promote the DPC to partners and broaden our membership with individuals and organisations. But we want to reconnect with our members to ensure that we are addressing their needs. Throughout the lockdown, we've talked at our members, we've given information to our members, but it's been quite a one-way process. What we want to do now is come back to the ground and say to our members, how can we serve you? How can we help you? What would you like us to do for you? So the open meetings have started up again from September with a range of topics and interesting speakers and presentations. And we want our members to come forward and tell us what do they want to hear at our open meetings. If they've been to a meeting elsewhere, or they've seen a speaker or heard a speaker that they think will be really good, tell us about it and we'll invite them to our meeting. The meetings are there for you, our members. We're also hoping to plan some social events, including an outdoor event in the spring or summer and a big Christmas party. So it's over to you, our members. What would you like us to do for you? The bottom line for our organisation is this: we are here to help improve the quality of life for disabled people in Calderdale. And if we can do it, we'll try our best. And if we can't, we'll try to find out someone who can and signpost members to those. So this is the end of the report. Our mobile number for anything that you would like help with is 07716 122 897. And that's through to our administrator, whose name is Nikki. You can also email info@disabilitypartnershipcalderdale.org. You can check our wonderful website, which is full of information, disabilitypartnershipcalderdale.org. And we also have Facebook, Twitter and Instagram accounts. And if you type in Disability Partnership Calderdale, it should take you to the page. Thank you very much indeed, and I hope you enjoyed the presentation.